It's Hot Seat. I'm Scott Mitchell, and this is the Commissioner of Mental Health, Carrie Slatton-Hodges. Good to see you, Commissioner.
Good to see you, too. Thanks for having me.
It's our pleasure. And this past week, we just finished up Mental Health Awareness Week in 2021. What is the state of awareness of the issues we have in Oklahoma by Oklahomans?
You know, I think they're getting better, and I think there's a number of things that have helped with that over the last several years. One silver lining, I think, from the opiate epidemic is that people saw mental health issues and addiction issues touch very close to home, and that's kind of helped with awareness. Also, there came some knowledge through that medications can be really important for people to be their best, and I think that's helped a little bit. But we still have a lot of stigma associated with these diseases, and so we still have a long way to go.
It's anecdotal for me, but for many, many years, I didn't understand it. I had people like in your department, Jeff Dismix, who's really kind of mentored me in understanding this issue because we cover health a lot on this program. And I'm wondering, how much farther do we need to go? Is there data that indicates where we're at as a state compared to the rest of the nation in terms of grasping the situation?
Well, most of the data is national, not state specific. But what it does say is that there are still a tremendous amount of Americans who are not comfortable talking about these subjects and that are not comfortable going to receive care or treatment for these subjects. They feel like they would be discriminated against by their employers, by their friends, by their family, if they were to do so, or if they were to be open about it. So we have a long way to go.
Okay, well, that's not great news, but I know you're working moving forward in terms of goals that you want to set. I was reading about it on your Twitter account this week. What are some of the things we need to know about where you're headed in terms of helping our state in this issue?
We have some of the most exciting things going on right now that I think in our state's history. One I'll focus on for just a minute because we're doing yeoman's work on it this year, and that's developing a comprehensive system for crisis care in our state. This will contain and start July 1st of 2022 with one statewide call number for any behavioral health crisis. That will be 988. So no longer will you need to call 911 and engage law enforcement when there is a behavioral health crisis. So it will have that number. That number will be able to electronically book same-day appointments, next-day appointments to your closest provider. It will also be able to have licensed mental health professionals that can talk to anyone, do assessments, intervene in that crisis through telephone. It will be able to disperse mobile crisis teams anywhere around the state to have face-to-face meetings with people. And then in addition to that, we're developing more what we call behavioral health urgent cares around the state, as well as some additional crisis units around the state so that people have a nearby place where they can receive the care that they need 24 hours a day, 7 days a week. So we're doing a lot of work this year, really to focus on getting people the help that they need and to reduce suicides in Oklahoma.
We've got about 45 seconds. We know what's happened during the pandemic. A lot of bad trends have emerged. What are some things that we need to know about that we can be helping your department and all of Oklahoma on?
You know, I think probably the most important thing is to ask your friends and family, if you see them having disrupted sleep, disrupted eating, being more withdrawn, ask the questions. Are you having thoughts of harming yourself? Do you need to talk to someone? Do you feel like maybe you're feeling hopeless or needing additional help? Ask those questions and help connect them to treatment and care. It's so important.
Commissioner Carrie Slatton-Hodges, Department of Mental Health and Substance Abuse, thanks for being in. Thanks for all you do.
Thank you so much for having me.
See this again at news9.com/yourvotecounts and follow me on Twitter @MitchellTalks.